my name is Connor Howes and today I'll be completing ACBN Practical Assessment 31, setting up for anaesthesia. This is attempt 1 of this assessment, and today we'll be setting up for Jexy Peters, who is a 37 kilo bull Arab. He is 4 years old and he is in today for a bilateral orchirectomy procedure. So before we begin, we want to wash our hands with hot soapy water for at least 20 seconds. We want to apply minimum PPE, which is disposable gloves, mask and a hairnet. Our clinic at the moment unfortunately doesn't have any hairnets as we are waiting for some in our order. So for the purpose of this video, I will not be wearing one. We want to begin now by checking the oxygen levels, and we want to manually turn on the oxygen canister. So to do that, we need to go anti-clockwise to turn on grey. I can see that it's sitting at 17,000 kPa and it's extremely full, so we have plenty of oxygen available for the entire surgical procedure. Then we want to check the vaporizer. We want to make sure we're using isoflurane, which is a liquid anesthetic inhalant agent, and we want to make sure there is enough within the vaporizer here for the entire procedure as well. And I can see that it was recently filled. There's about 3/4 in there, but we also want to make sure that everything is screwed tight. There's nothing that can come undone, and there's no leaking anesthetic. Then we want to be checking the soda lime expiration date and making sure that it is not exhausted. So to do that, we'll check the soda lime log, which is around here. So this is marked off every 15 minutes, every time we're doing a surgery. Okay, I can see that it was used for 3.5 hours, and there is still about 2.5 hours of viability left until it does need to be changed. So 6 to 10 hours, we do want to change our soda lime after that by checking the log. Not necessarily the color, because if the color returns to itself, to its original color at the end of the day, following the next day procedures. So now we want to select the appropriate breathing circuit and bag for this patient. So let me go grab one now. He will require a rebreathing system which is above 15 kilos. So today we'll be using a universal F rebreathing system, which I have is all ready to go. You want to make sure that we have connected it correctly. There is no areas of air to escape. It is connected, it is tight, there's nothing coming through. Also with the soda lime canister, we want to make sure that the pop-off valves are open. We want to make sure that it's connected to the scavenger system in the back here, and that there is no areas of escape. Everything is tight, everything seems to be great, in great position. Then I've got the rebreathing tube set there. So now we want to get the appropriate size rebreathing oxygen O2 bag for Jexy. So the calculation that we do is 10 mils by the body weight, which is 37, times by 6, divided by 1,000. That will then give us 2.22, which we then want to round up always when we're using the O2 bag. So he will require a 3-litre bag. Funnily enough, I have prepared one here earlier. Want to make sure that it is connected, it is tight, there's no air escaping, and you don't want to be reefing on the bag, you don't want to be pulling it down, you don't want to be causing any rips, tears or holes in it. So now we want to set up all of our equipment ready for the procedure. Unfortunately, our clinic does not have a capnograph, ECG machine or multi-parameter machine, so I can't set them up beforehand. However, I would get them prepared if we did have them available. Our clinic only has a pulse oximetry and an Apple machine. So to begin, I'll turn on the pulse ox, getting that prepared, and I'll attach the Apple alert here to the end of the rebreathing system. Before we start surgery, I like to test the pulse ox on myself, making sure that it is reading and that we are getting an SpO2 reading. Great, as you can hear. So that one is all set up now. And I'll just turn that one off. So that is all of our anaesthetic monitoring equipment that we have available in the clinic that I can possibly set up. Now we want to leak test the machine. So for the leak testing or pressure testing of the machine, we want to make sure that we are closing the pop-off valve. It is completely closed, everything is tight. I've got my thumb over the top, and now I'm just pressing the O2 button now, inflating the O2 bag until no creases appear. And I'm checking for any holes, air escaping, any rips, any frayed edges. And then we are opening the pop-off valve, leaving our thumb over the top of the rebreathing tube, and we are not taking our thumb off. We are only opening the pop-off valve to expel that oxygen. We now want to do this 2 more times for a total of 3. Great. Now I will attach the Apollo machine, the Apollo system back up. So now we want to prepare and make sure that we have all of our consumables ready for the entire procedure. So I've already been prepared here. We'll go through it now. So we want to get 3 ET tubes of various sizes, similar to the size of the patient, and we want to pre-inflate them prior to anaesthetic, making sure that there are no holes, that there is no gross contamination, and there is no air escaping out of the ET tube. As you can see, here at our clinic we attach the ET tube tie already onto the ET tube. So these will be inflated now for 1 minute. We've got them all here. I've got a 7.5, an 8, and an 8.5 as well. I'm just testing the cuff now. And we'll set that to the side, and then I'll come back and I'll deflate them once they have all been checked and they've all been leak tested. Great, so I'll bring the nursing trolley over here. I've got my emergency crash kit. As per our clinic policy, we always have it on hand to the side of the surgery. I then have all my desexing, tattooing equipment, so that includes the tattoo gun, ink and cotton swabs. I've got water-based lubricant here, which will be used for the ET tube, the intubation. I've also got nail cutters as well, as they'll be required for later in the procedure, as it's been asked for by the client. I've got visco tears as well, which is eye lubrication. I then have a syringe cuff here, which has been checked. I've got a temperature probe. I've also got some scissors, temperature probe covers as well, if they'll need to be handy. I then have all of my passive warming equipment as well, so that includes bubble wrap, 2 hotties wrapped in towels, and 2 blankets as well. Unfortunately, our clinic doesn't have any active warming measures, such as bear huggers or electrical mats. However, I would have already preset them up and got them ready. So, a minute has passed there now, and we can now deflate the ET tubes. I want to make sure that they deflated completely. I've squeezed them, there's no escaping air, there's no holes. My name is Connor Howes, and today I'll be completing Practical Assessment 31, setting up for anaesthesia. So I've just pre-inflated and deflated 3 ET tubes required for Jexie's procedure. So now we'll draw up the the medications required for Jexie's procedure, including the pre-medication, the induction agent, and the post-op drugs. So we use ACP or aceclomazine and atrostat or atropine as our pre-med. Then we use alfaxan as our induction agent. We have loxicom as our analgesic, and then we have moxicillin as our antibiotic post-op medication. I won't be drawing any of these medications up as they are not required right now. However, I will be using sterile water to demonstrate how I would draw up a pre-medication drug. So, based on the vet's instructions and his particular dose rate that he's requiring, we're using the calculation weight times dose divided by concentration. And let's begin. So his weight is 37, multiplied by 0.03, which is the dose rate for atro, and then divided by 0.65 equals 1.7 mil of atroside. So I'll demonstrate that now. We want to open it sterilely, the needle, so we are not touching the hub. Then same with the syringe. You're opening it via the peeling down, not touching the end here, keeping it sterile, removing the needle, drawing back further than the recommended dose. Push that to 1.7. That is 1.7. Cap it. This will get thrown into the sharps container. And we'll put another sterile needle on. And now I will just get a pen to label it. So it's atracide. The date is the 20th of the 8th. And it's for Jexy. So we'll pop that one there. So for azithromycin, his weight is 37 by 0.5, the dose rate recommended by the veterinarian, and divided by 10 mils equals 1.85 mils required of ACE. Then for the induction agent, it's 37 as the body weight, times by 0.2 for canines as the dose rate, divide that by 2, equals 3.7 mils of our vaccine required. Now for the post-op medication, we have Loxicon, which is 37 by 0.2, divided by 5 for canines, equals 1.48 mils of Loxicon. And then Moxilin, which is the antibiotic injection, is 37 by 15, which is the dose rate required by the veterinarian, divided by 150 milligrams per mil, for 3.7 mils of Moxilin required for Jexy's procedure. Now this is as per the vet's instructions and what he's requiring. Now we will make sure the cervical light is turned on and positioned correctly. The cervical table is positioned correctly and locked down. But other than that, that is everything today. That is ACVN, Practical Assessment 31, setting up for anaesthesia.